I'm Muriel Bowser. I'm the Mayor of Washington, D.C. We are here to provide a brief update today on the district's response to COVID-19. Let me start by displaying the district's public testing schedule for the rest of this week. We continue to urge residents to start by contacting their own health provider if you feel sick or believe you have been exposed to COVID-19. We also remind residents that testing should not be used to replace staying at home and being judicious about your activities. On Monday, the mayor's order on travel and self-quarantining went into effect. We released the 27 states that DC Health has classified as high risk for COVID transmission. We want residents to take a look at the list and to make smart and safe decisions about traveling and be mindful of how traveling could affect our community. Now is just not the time to travel to many locations where the virus is circulating and where you are more likely to be exposed, infected, and then bring back that infection, that virus to others. A reminder of what the mayor's order requires: if you travel to a high-risk state for non-essential travel, when you return, you must self-quarantine for 14 days. This means that you only leave your home or hotel to seek medical care or to get food. Examples of non-essential travel are beach trips, vacations, and work conferences. If your travel is essential, when you come back to DC, we still ask you to monitor yourself for symptoms and limit your activities for 14 days. Examples of essential travel are traveling for essential government functions or essential business, travel to care for minors, elderly, or dependents, and travel required for law enforcement or court order. Again, though, the idea here is that we all need to be mindful of where we go on our free time, because the only way that we will get our numbers down and keep them down is working together. Today, we announced 54 new cases of COVID in our community, and sadly, an additional Washingtonian has succumbed to the virus. Beginning this morning, we will also update how we report our positivity rate so that now we report a 7-day average instead of a daily rate. We will also be lowering the threshold to move to phase 3 to 5%, and Dr. Nesbitt will say more about those adjustments. Lastly, and non-COVID related, I want to remind DC residents about a working group that we launched to consider public spaces in DC that might not reflect or represent our values as a community, and to put together recommendations for actions we can take, whether that's removing symbols or renaming spaces. So please go to Mayor.dc.gov/DCFACES to take the survey. And with that, we'll take your questions. Yes, sir.
There's been quite a bit of talk about people coming back to school from, summer break, particularly colleges and university. So is that essential? What's the situation with a college student who's coming back to, say, Howard University from New York, or I don't know if New York's on the list, but obviously something that's on the list?
So education is essential. Travel for education is also essential. And you will remember, Sam, that our Reopen DC Advisory Committee made some recommendations around schools, K through 12, and higher education. And in those recommendations, it included as a phase 2 activity in-person education. And so as we are going and approaching the school year, those we will continue to be in phase 2, we suspect. So in phase 2, all of those activities can open. The Reopen DC Advisory Committee also recommended that colleges and universities participate in the campus planning process for reopening. We have a planning process for all our colleges and universities. They usually take place every 10 years, where they tell us about housing and numbers of students and use of public space and transportation and all of that. So I engaged that process for their reopen plan. So the DC Office of Planning has been the lead agency in consultation as ordered in one of my executive orders with HCMA, DC Health, and the Deputy Mayor for Education. So we reviewed all those plans. I met with all of the college presidents, and on Friday, we issued a letter to ensure that they were in compliance with everything that we needed to each of the presidents. Part of that letter was letting them know that a travel advisory would be going into effect, and that their students from those states enumerated by DC Health would need to self-quarantine on the campus or in their off-campus housing, and that the universities would be able to let us know who was in quarantine.
So they will be quarantined for 2 weeks?
They will. They will be expected to quarantine for 2 weeks. Yes?
Mayor Bowser, I'm wondering, staying with the quarantine order, have you heard from any governors, mayors from any of these 27 states? Particularly, I'm wondering about Delaware. The mayor of Dewey Beach, Delaware, was on television last night urging you to speak to the governor of Delaware and to reconsider having the shore on your list, because he talks about the economic impact, the negative economic impact it's having on his economy there.
Well, I can certainly empathize with the mayor. I haven't talked to him or to the governor. I'm always, of course, happy to talk to all of my colleagues about what we're dealing with locally. And quite frankly, Mark, there's a lot of activities that we could turn on in Washington, D.C. That would turn our economy back on. I go in parts of DC and I'm almost in tears with the loss of business activity and people at work and people just enjoying our city. So this virus is causing a devastating economic impact on us all. And in my view, the only way to get back to normal and to get back to an economy that is roaring is to make sure that we're keeping the virus contained. And when we have contained the virus, we can legitimately start economic activity again. Yes?
Can I ask about the mask order? Several large retailers who are located here in DC, including Walmart and Lowe's, have said that they will not enforce the mask orders. They will put signage up, but they will not have their employees enforce the mask orders in their stores, and they will service customers who come in without masks because they're afraid that their employees might get injured if there's a violent.
Then they should call the police.
I'm sorry?
They should call the police, and the police will enforce it.
So if a customer comes in and is not wearing a mask at Lowe's, the Lowe's manager should call 911.
They should, absolutely.
MPD will come and enforce.
They should call the police.
And MPD will enforce the mask order.
MPD will be made aware of the complaint. They should call the police.
Okay, well then have you seen the video of the outdoor concert the other night where MPD was standing by but did not enforce the mask order? There were clearly, the ANC commissioner, I think, put this out on his social media. There were clearly, I think, hundreds of people there violating all kinds of phase 2.
If you're talking about an illegal block party where there were more than 50 gathered, it is in violation of our orders. It is in violation of every reasonable measure to contain a virus. If you're asking me, is MPD going to be able to stop every intentional group of people and lock them all up? Probably not. That wouldn't be a realistic response. And I'm happy to talk to the ANC commissioners about a community response. If we are all in this together, we need to make sure that members of our community, our brothers, our sisters, our nephews, are not participating in that kind of activity. So it's fine for me to come up here and you ask me questions. Well, why is the MPD? I can do that all day and all night. That's not going to make us safer. What's going to make us safer is ANC commissioners, community groups who see this type of activity, who know the people who are involved, to get them to stop participating in that type of activity. Yes.
Mayor, I did see that video, and you see the police there monitoring but not interfering with the activity.
Mm-hmm.
Should they get on a bullhorn and say this is illegal? I don't know.
I mean, I think that's one thing that we think has somewhat worked early in that pandemic, is issuing that type of notice. But let's not act like we haven't spent the past 6 weeks saying that the police shouldn't lock up young Black people. I mean, let's not pretend that that's not happening. And so our communities have to take some responsibility, including ANC commissioners, and saying, look, this activity is anti-public health, is anti us getting back on our feet, and we have to bond together to put an end to it. Any other questions? Yes.
If I could ask Dr. Nesbitt, Mayor Bowser, you had mentioned a change in the metric tracking for getting to phase 3. If Dr. Nesbitt could explain that.
Yes.
And then Dr. Nesbitt, I also have just kind of I mean, maybe I have not been, I'm sure, paying as close attention as I should, but
No.
if somebody is exposed to the virus, say today, and they contract it, how long until they would actually test positive? I think I'm trying to get to, if somebody thinks they may have been exposed, how long should they wait before they get tested where it would actually show up in the test? Does that make sense?
Yes. It makes sense, but you sort of asked two questions in that one, so I'll help you with that. To go back to your first of three questions, actually, Mark, we have been very thoughtful in terms of the types of metrics that we want to use and the best way to measure our progress. When we first set out to have goals for our positivity rate, and we were looking at where rebound may happen. There were things that we set out for where we should be before we began our phase reopening, phase 2, moving into phase 2 and phase 3 in terms of our positivity rate. And those original goals were at 15%, 10%, 20%, 15%, and 10%, I believe. We have now learned a lot more about where you should have your positivity rate, test positivity rate, which is the percentage of people who have a positive test over the total number of people who have been tested on a given day. And we now have far more evidence that suggests in order for rebound not to occur, for you to have a second peak or a second wave after you turn on more activity, that percentage should be below 5. And in some instances, if you can keep it below 3, even better. So we have adjusted our goal for moving into phase 3 from 10% down to 5%. The other thing that we have done is that we used to look at it that we wanted that goal number to be below 5% or 10% previously for 7 days. And the reason why we did that is because if you go back and you look at our data over time, you would always see that there would be a dip in the total number of people tested on the weekends. Some of that is a function of the doctor's offices being open and offering testing on Saturday and Sunday. Our mass testing sites don't have as much availability on Sunday, so the total denominator would always get smaller. And if the total denominator is smaller, you'd always have a higher test positivity rate on a single day. So to adjust for that, we would have wanting to look at it over 7 days, that number being low. So we've decided to just use the rolling average, a 7-day rolling average of test positivity, instead of looking at individual days. So those are the two major changes that have happened in terms of how we report out the test positivity rate on the dashboard. In terms of if someone has been exposed, and when they would become positive. There is compelling published evidence that from the time that someone becomes exposed or has been exposed to a confirmed COVID-19 individual, most of the evidence is published from PCR tests, which is a common test that was most widely available. Now we have antigen tests that are available. Is that there would be, they would develop symptoms and become positive up to 11 days after their last exposure, which is why we talk about the incubation period being 14 days. We quarantine for 14 days, and we're very clear that testing your way out of quarantine is not an option. That's where all of that scientific evidence really comes from, is how many days after your last exposure to a positive individual will someone develop symptoms and when they can have a positive test. So that 14-day incubation period of the virus, 14 days after being exposed, you can still have a positive test. And individuals, again, documenting as far as 11 days out, and incubation period of the virus being known to be 14 days if you're exposed to someone with active virus. In terms of the best time for someone who believes that they've had an exposure to get a test, when we have people who are close contacts to a positive individual, we recommend the 3 to 5 day time period after you've had a known exposure. And that's, again, when people begin to develop active virus, or when the most likely time that you'll have active virus replicating on a PCR test. So that's the sort of the nutshell answer. If you've had a close contact, or you believe you were exposed, getting a test immediately 1 day after, typically not advisable, because whether or not you'll have virus replicating and a positive test show up that first day is probably not as likely, but that 3 to 5 day window is probably when we would most likely get a positive test on the most commonly used PCR test.
I appreciate that.
Mm-hmm.
Any more questions? Last question.
Mayor Bowser, I think we're about 2 months anniversary when things really started to get crazy at Lafayette Square. And I'm wondering, I know we haven't gotten the after-action report yet from MPD and whatnot, but what are your thoughts looking back on that as to where the movement is going, and both the Black Lives Matter movement and just policing these things here in the district? What have we learned? Where are we at? If it's not too soon to look back.
I think that I'll probably have more to say about looking back in terms of the federal overreaction. I will tell you one thing I'm struck by, Mark. In the last week, hearing so much news reports about how incredible it is that what's happening in Portland in terms of unidentified federal police or other forces descending on Portland, and the seeming amnesia that people have that this happened in Washington, D.C. in the end of May into June. So that the idea that what's happening in Portland is something new just astonishes me. We saw that attack here in Washington, D.C. at Lafayette Square. So I think what I said then is that the whole nation should be concerned about what they saw in Washington, because it could happen someplace else. And sadly, we're seeing exactly that. Okay, thank you.